Last 2 decades, illicit drug use has emerged as a public health and safety crisis, with overdoses becoming the leading cause of injury or death in the United States. Opioids, specifically heroin and prescription pain relievers, are the cause of most overdose deaths in the United States, with the death rate more than doubling since the year 2000. In South Carolina, which is where I'm from, at least 95 people died from heroin in 2015, which is almost twice as many as the previous year, and more than 560 died from the abuse of prescription opioids over the same period of time. The epidemic is growing, and lives are at stake, literally. It is imperative our nation maintain a strong, coordinated effort across the federal government to combat drug abuse from design, manufacturing, distribution, prescription, and consumption. In 1988, Congress established the Office of National Drug Control Policy as part of the Anti-Drug Abuse Act to coordinate drug programs across the federal government, advise the administration on national and international drug control policies, and create and oversee the national drug control budget. ONDCP is uniquely equipped to address what role the federal government can play in determining what kinds of clinical, social welfare, and economic programs could impact and reverse drug abuse problems in our country. ONDCP was last authorized in 2006. The authorization lapsed in 2010, but the office has continued to receive appropriations each year. In December 2015, this committee held a hearing to discuss various proposals for reauthorization. We heard from the then director, who testified combating the abuse of prescription drugs was a top priority for the agency. However, since then, ONDCP has failed to produce a formal national drug control strategy and a national drug control budget, which is supposed to be released no later than February 1st each year. In the meantime, deaths due to opioid overdoses have only increased in the U.S. in 2016. No office is perfect. God knows Congress certainly is not, but it is our responsibility nonetheless to see that deadlines are met, particularly statutory deadlines, resources are well spent, and the leadership that can be provided nationally is being provided. There is a prevention aspect, a treatment aspect, an education aspect, an enforcement aspect, a punishment aspect, and an oversight aspect. The federal government has long occupied a space as it relates to both the illicit use of legal drugs and the use of illegal drugs. Today, we will have an opportunity to consider options for reauthorizing ONDCP and learn about how this agency can work toward the goal of reducing and ultimately eliminating our nation's opioid crisis. We will also examine how ONDCP can help mitigate the significant harm communities across America have felt as a result of our nation's opioid crisis. There are many areas worthy of exploration today, and we thank all of our witnesses for appearing before the committee. We look forward to your testimony as we consider next steps for reauthorization. And with that, I would recognize my friend from Virginia.
I thank the chair. And I want to thank him personally for having this hearing. I also want to thank him personally for